Hello everyone, this is Dr. Pradeep Reddy. I completed my MBBS from Government Medical College, currently pursuing post-graduation DNB General Surgery. So, I am here to help you to choose the right thing in 2024 NEET PG counseling. This is my first video. I am going to answer the most important questions about MDMS and DNB. Just because I don't want anyone of you to choose the wrong thing in 2024 NEET PG counseling, because you don't know about DNB or people around you think that DNB is less than MDMS. What happens is that people who got a good rank will be taking MDMS because they get it. People who have money will be taking MDMS in A, B, or C category as they can afford it. People who got a middle rank belonging to middle class or lower middle class, and people who don't want to waste their money should not miss the opportunity called DNB, which is equal to MDMS. There are advantages and disadvantages in both MDMS and DNB. So watch this video till end and decide on your one what you want. The first question is, what is the difference between MDMS and DNB? Both are 3-year course. Both of them have equal opportunities in all the ways. MDMS is a PG seat in medical colleges, whereas DNB is a PG seat in corporate hospital or district hospital. In MDMS, the state government will be your boss, whereas in DNB, the NB is your boss. In MDMS, in state medical colleges, the stipend will be given by the government, whereas in the private medical colleges, the college will decide how much of the stipend to be paid. Whereas in DNB, the stipend will be same as the government medical college in that state. More differences will be covered in the upcoming questions. Second question, what are the advantages of MDMS for DNB? MDMS you'll be doing at the medical colleges, so you'll be having classes regularly. Whereas in DNB, you'll be having online classes which will be conducted by the NB daily, not like the live classes in the medical colleges. And these classes will be conducted during your duty hours, so you might miss most of the classes. If you are not a student who completely depend on the teaching and you can study yourself, then DNB is a good option. In MDMS, the college will be conducting the final exam with some externals, so almost 100% pass rate will be there, and you will get the degree for sure. In DNB, the theory will be conducted by the NB, and for practical, you will be posted in some other cities or some other state, and you will be tested practically by someone you don't know. So it's difficult to pass, but recently the pass rate has been increased in most of the branches, so this is not one of the reason to back up from DNB if you're a good student and you got a middle rank. After MDMS, you can directly get into the teaching in the medical colleges, but according to me, not many young doctors will choose teaching over practice. If you're doing a DNB in more than 500 bed hospital, then you are same as MDMS postgraduate. If you're doing in less than 500 hospital, then you have to do 1 year of extra SRship to get into the teaching in the medical colleges. Question number 4. Which is best for surgical branches, MS or DNB? It depends. If it is a good medical college in good place with less number of seats, more hands-on, more patient load, choose it. If it is an average or bad medical college in some peripheries with less number of patient load or not much facilities in the hospital, better to choose DNB in the big cities where you will be getting more exposure to different types of cases and different surgeries. If a medical college with many seats nowadays, 15 to 20 seats per year, which becomes 45 to 60 PGs in one department in one college, where there will be less hands-on. So better to choose DNB in the big cities, where you'll be getting more hands-on. If you're not getting an MDMS in the government college and you don't want to spend money in the A, B, or C category seats, better to choose DNB in the big cities like Mission Hospital, Trust Hospital, and the Railway Hospital, where you'll be getting more hands-on. Question number 5. Which is best for medical branches, MD or DNB? If you are not getting MD seat in good medical colleges, better to choose DNB, which will be the best option for you, because here you will be seeing different types of cases, different types of complicated cases, different types of investigation will be available, and standard of care will be high, which cannot be seen in most of the medical colleges. Question number 6. Why do people think that DNB is less than MDMS? Previously, DNB was not equal to MDMS because it was not having all the opportunities that MDMS candidate is having. But recently, few years ago, NB took over the DNB, and in Supreme Court, it was made clear that DNB is absolutely equal to MDMS. The reason for this may be number of seats in MDMS are increasing too much, the quality of education and exposure to patient is decreasing. Because of reservation, Good student with good rank and no reservation are not getting the opportunity to do their dream branch, but the student with not so good rank and who does not deserve the good branch is awarded with the branch in which he fails to excel. Anyone who have money can buy a MD/MSc, so rich idiot will be awarded and poor intelligent will be punished. So these are the reason why NB is making the DNBs where there are no reservation, no one can buy this seat, good stipend, payable fees, and making sure of online classes by the best professor, so only merit will be awarded. Thank you. If you think the information is useful, please like and share the video, subscribe the channel, and comment down below for any queries.